Clay Crossan here with us for the next half hour. For the hour and a half after that, Ryan's away, we will be open lines on wellness topics only. It won't be on any general topic, but you can ask any question you'd like. You have to tell the board op exactly what your question is, so don't just going to be, and we are full consultation. We're going to answer very, very specific questions. Or I'll just talk about different products and nutraceuticals and how to intervene. What people need to understand is our approach here at Nutrimedical Report and the Clay and Iron Show is we provide you with a broader and deeper range of information than any other show in this or any other network, radio or television. We also provide, by the way, a live stream TV channel, and all of our archives on all of our shows, including shows that I do on other networks, are free. You don't have to pay. All you have to do is buy a product and you have access. So you become a Nutrimedical member, you have access to our wellness conditions, and I have a ton of updates to do of many, many, many consults recently. And what people should understand, I provide all this service because I'm trying to provide you a way of integrating the best of medicine and functional medicine. Now, functional medicine is what we call living pathology. It's finding out what things are out of balance before you even get symptoms or signs. Medicine in the last few centuries has really arisen out of surgery and barber treatment, where the surgeons had their instruments, and the convergence with herbology and pharmacology, pharmacy. Back in the 1940s, most of the pharmacists made their own nutraceuticals with vitamins and minerals and special tinctures themselves. It's only since really the Second World War that pharmacology has risen to try to dominate medicine. And in fact, only about 20% of drugs are appropriate 20% of the time. What you should do is be integrating to know what is appropriate surgery, what's appropriate alternative medicine, and what's appropriate in terms of called integrative or replacement medicine. In other words, it's like with Professor McCanny talking about replacement power. We're not talking about alternative energy. When we talk about the wing generator program, or when we talk about NutriMeds, these are not an alternative to drugs. They are completely replacing them, and in many cases, the drugs have no way of even competing. For example, reversing osteoporosis, reversing congestive heart failure, reversing dementia, reversing many, many conditions, including allergic bowel syndrome. I had a lady this morning who developed such serious complications after her surgery, she ended up with an allergic large bowel, and they had to redo a total colectomy. Now she's got SBO, or small bowel overgrowth, which, of course, the conventional doctors have no clue how to treat. We treat hundreds of conditions here around the world. I consult, and we have advanced we call technologies that allow us to evaluate them. Firstly, I have a consult form, and by the way, if you can't find the form, you just hit the More Info button on the consultations, either email or phone consults. If you're one of our elite customers, those don't cost you at all, but if you're not a customer, you're trying to get a consult, or if you have send me a ton of stuff and you expect me to evaluate it, which takes hours, I will send you a consult fee request to do that. But the form is just hit the More Info button and the PDF will pop up. We have the quantitative resonant magnetic analysis developed by Dr. Yu Zheng that actually looks at your quantum biomagnetic fields. We have the 8D LRS, the latest incarnation of the bioplasm NLS from Russian Space Agency and Dr. Nestorov from the Russian cosmonauts. Dr. Nestorov's most advanced machine called a Metatron, which we'll be talking about today in the last hour, for hour 4. Now, we want to talk about today with Clay some of the latest challenges we've had, because what we provide here is not only we tell you what's appropriate surgery, medicine, or specialty clinics around the world that are available, whether it's in Tijuana, Mexico, Europe, or Brazil. We tell you what types of treatments you can do at home. In many cases, you can become your own Dr. You. You don't need to rely necessarily on health professionals that will put you at risk of all kinds of complications or put you on inappropriate drugs, like this poor lady that contacted us. And you don't need to be a victim. So that's important. And sometimes, one of the recent nutraceuticals we have, which is Allergon, I'm changing the name in the future. It's going to be called cytokinase, because a lot of people think it's just for allergies, but in fact, Allergon is an enzyme. It's the first and only enzyme that actually gets rid of histamine, but it also gets rid of other cytokines, interleukin-1 beta, and a cascade of inflammatory molecules that your body makes in response to stealth pathogens or toxins. It's very bad for you, not just for allergies, but for autoimmune diseases, the underlying conditions that create cancer and stress cells, underlying conditions that cause brain inflammation, for example, that can cause dementia or behavioral disorders. Many different health conditions are what we call a cytokinopathy, where there's excess inflammatory molecules being released by the immune cells. And the Allergon, which I should call cytokinase, gets rid of cytokines. It's, their Aller block is a natural antihistamine, which is like your oral drug antihistamines, which have horrible side effects, but ours doesn't, because it's all natural. So, Clay, let's talk about Allergon, and which my new name I call cytokinase, because it gets rid of cytokines out of your body, whether you have autoimmune disease, inflammatory reactions of many different organs and solid organs and tissues. And it doesn't just get rid of histamine, it gets rid of histamine that will trigger off other cytokines, other inflammatory molecules like IL-1 beta, which is what we call a fulcrum cytokine. So what makes it so unique?
Well, Allergon, I do like the name change. I don't think people really understand that the foods that they're eating and ingesting have high amounts of histamine. And as a result, that kicks off this cascade of inflammation that doesn't just result in hives or runny nose, but could be an effect to your central nervous system, can be an effect to your hormone production, to your immune system, and they don't really recognize it because the general public doesn't know what you and I know regarding histamine and its relation to how it works in the body. But the Allergon, what it is diamine oxidase, and that's an enzyme that the body produces to quench endogenous histamine response. And most people don't produce enough DAO, especially as they age, to quench the amount of free histamine that's in the foods that they're ingesting. So as a result, they're continually offending their body with histamine, and as a result, with inflammation.
Right, and it can inflame their brain, so it can affect behavior, depression, anxiety attacks, mood disorders, sleep disorders that can be triggered off. It can infect other organs, inflammation of your liver, your kidneys, etc. Cytokines can be a factor in your joints, causing joint inflammation, even affecting stress on the adrenal glands and blood sugar control. So I tell people the cytokinase, which is my new name for it, or Allergon, it doesn't just help to block allergies with the use of things like Aller block, which is natural antihistamine, and the other cytokine blockers are high-dose Power C and cell defense, which is curcumin. Curcumin is a very good stabilizer of membranes to reduce cytokines. They each work in totally different mechanisms, which is why they're synergistic, or they multiply each other, not just add. And these are very unique, by the way. This enzyme, we have the only source in the world for this particular enzyme. I call cytokinase now. So that's a pretty good name. I think it kind of explains it better, although people have to know what is a cytokine. That can be confusing too, I guess, right?
Yep.
So let's talk about some of the other kind of questions we had. I had this lady earlier, and we'll call her J for her first letter of her first name. And she's pretty overwhelmed. She had a reaction to a surgery because of a biking accident, and had a metals intolerance response that caused her bowel to become allergic, and then ended up with serious problems with her colon. So they actually did a total colectomy a few years ago. She has bad small bowel overgrowth, and so on. So here's how I approach it. Number one, you've got to heal the gut wall. So you're going to use Nutrimune, which is immunoglobulins, and GastroHeal. You have to clear the yeast and the other pathogens that are going to create a biofilm with allicin med and berberstatin. And because she doesn't have a large colon, there's no point in giving her a probiotic, because a probiotic is supposed to exist in your large bowel, and she doesn't have one. So what you're trying to do is get rid of SBO, or small bowel overgrowth, and if you do this thing called a hydrogen breath test, it'll pick that test up. And you can do that at directlabs.com. Just order a hydrogen breath test. If you've got really messed up bowels, the first thing to think about is, do you have a dysbiosis? Do you have yeast and other pathogen overgrowth with a CDSA2 test at Genova Metametrics Labs through directlabs.com, and a small bowel overgrowth, which you can do a hydrogen breath test. That's how you integrate functional medicine with what we're telling you to take. I'm getting lots of people requesting how to approach cancer. And of course, my approach to cancer is a stress cells that are responding to stress by switching on and off genes. There's always the presence of stealth pathogens in the tissues. And there are also always the growth of stealth pathogens that are triggering on and off genes to cause a problem. So people should be aware of that. So here's what I would tell people to do. Firstly, take for example, Maligna Arrest, which is going to block the metabolism, Maligna Block, and ellagic acid, at least 2 capsules twice a day, and the Maligna Arrest, 2 packets twice a day. Take Micelle D3 and Micro D2, which restores normal T cell activity, and Nutriimmune immunoglobulins to boost the immune system and NutriDefense. Strip off the enzymes to strip off the capsule of the tumor so that it can't shield itself from being, or hide itself from being the immune system, with Inflammex and curcumin, which is cell defense. Stop the free radicals or stress that's making the cells behave abnormally with Nutrichala, Regenerex, and Cell Detox Glutathione and Carnosine for singlet oxygen. And then, of course, we recommend that they get to a clinic for the Coley's vaccine, dendritic vaccine, which is where they take the RNA of the tumor, actually amplify your T natural killer cells to actually attack the tumor. And we use augmentation with hyperthermia, hyperbaric oxygen therapy, and rebalancing your biophysical body with the 8-DLRAS and the X-Vitalizer to rebalance your bioplasmatic body and change your biophysics. And detoxification, of course, remove heavy metals, Keeler Max, our ultra-liquid zeolite for chemicals, xenoestrin detox, life support, and NutriDefense, and that will yank the chemicals out, as well as Green Tea Select, which is very powerful catechins. The NutriDefense and Green Tea Select catechins are extremely good at pulling out toxins, and the xenoestrin detox. And BioLVR, Semethyl, very good for methylation pathways to remove heavy metals, and methylation to remove a lot of the chemicals. And if people are skeptical, I say, look, we can do a fat biopsy. We can have it done by a local doctor, fired off to Dr. Slonwhite's lab in Richardson, Texas. Or we can do red cell toxicology and high-pressure chromatography, and we can even look at radiotoxins, or send it off to the Environmental Health Center of Dallas to measure your volatile hydrocarbons. A lot of people think, well, how does cancer happen? Cancer is an infection that grows on the basis of toxins in your tissue. How's that? Cancer is an infection. And if you don't approach it as an intracellular infection of viruses, mycobacteria, fungi, and etc., and nanobacteria, then you can't fix it. And so the doctors that use commando approaches that kill the immune system, they're wrong-headed, and they will kill you or ruin your immune system or cause you to develop a new cancer because they haven't approached the underlying problem. And I don't have the restraint anymore to tolerate my colleagues that don't get it. So you can understand that I'm very frustrated with them, and my frustration now is being properly taken out, where I just kind of tell it the way it is and tell people how to find out, especially clinics where they can get treatment and fix it. So, Clay, one of the things we often hear is about heart disease. And let's talk about a couple of these. Gamma E plus to repair your ion channels, and supernox, magnesium glycinate, and all the omega oils, omega supreme krill to protect your artery walls, omega supreme, if you take it 2 capsules twice a day, you cut your heart disease risk for pretty well every kind of heart disease in half. Ellagic acid to heal the vessel walls, and for the energetics in the heart and blood vessel walls. Vascular care, propionyl carnitine, CoQ10 supreme, and CoQ10 ubiquinol. You should take both. And to stop the vessel damage and free radicals, cell detox, glutathione, carnosine, and NutriDefense. So let's start off with Gamma E+, and of course Cardiovasc, which is our premier heart formula. But Gamma E+, and Supernox, and magnesium glycinate, let's look at that trio. Because a lot of people think, well, what is heart disease? Well, heart disease basically is oxidative stress causing fatty acids to precipitate plaque in your artery walls, caused by a hypometabolic state. And in other words, Dr. Broder Barnes proved that everybody that gets heart disease has hypometabolism. Now, I'm not going to necessarily say hypothyroidism, because their T3 may be normal, but their reverse T3 may be elevated, and their core body temperature is low because they're basically being shoved into suspended animation with elevated reverse thyroid hormone. So you can have normal free T3, but very high T4, reverse T3, and you may have a lowish TSH, because the TSH is useless if your reverse thyroid hormone is high. The best way to measure is your core body temperature will be low, and these people are all hypometabolic. They all have syndrome X, leptin and insulin resistance, and their fatty acid and cholesterol metabolism are abnormal. And of course, if you don't repair their ion channels with, high dose magnesium and Gamma E plus and tocotrienols, you're going to damage them if you give them the conventional drugs that doctors give, which are calcium channel blockers and beta blockers. So let's look at Gamma E plus. Why is it so important?
Yeah, Gamma E plus I really like. It's a blend of
form.
Your voice sounds really kind of funny on your phone there, Clay. I don't know if you're on a headphone set. It sounds like you're inside a tin can.
Can you hear me now?
A little better. That's better.
Okay. Yeah, no, I'm not on a speaker or a headset. I have the phone right up here to my ear.
Ah, okay, I can hear you. You're getting a sufficient amount of radiation from it, right?
Yeah, exactly. Thanks for that.
Unfortunately.
Yeah, the Gammy Plus.
I have to get you a tubeless headset so you don't fry your brain while you tell us all these things to stay healthy. Don't mess the MF.
Yeah,
okay,
so
go ahead.
Gammy Plus. Go ahead, Doc.
So Gammy Plus, tell us about it.
It's a blend of tocopherol. So a lot of times you go to the store to buy vitamin E, and what you'll get is just D-alpha tocopherol or DL-alpha tocopherol, which the DL form is the synthetic form of vitamin E. Well, if you're going to eat vitamin E in its natural form, you're going to get not only D-alpha tocopherol, but also you're going to get D-gamma tocopherol, D-delta, and D-beta tocopherol, as well as tocotrienols. So what the Gammy Plus is, it's a blend of all of these together, just like you would eat it and find it in nature. So your body recognizes it as it should and absorbs it a lot more efficiently and effectively than just taking D-alpha tocopherol store-bought by itself.
Right. Now, what magnesium glycinate malate and Supernox for vascular disease?
Yeah, that's the best form of magnesium you can get. It's a true amino acid chelate. So what it is, it's bonded with glycinate so that your body recognizes it like a protein. So as a result, you can take a lot higher amounts of this form of magnesium without getting gastric upset or diarrhea. You go buy some magnesium in the store, things like calcium oxides. They typically irritate the stomach. They'll give you diarrhea. You can't take as much. They're not well absorbed. It's kind of a waste of money, in my opinion, unless, of course, you have constipation or something. And even then, there's better forms of magnesium that you would take, something like magnesium citrate instead.
Yeah, the magnesium glycinate malate works basically, it's attached to glycine, which is a very simple amino acid, and malic acid goes directly into the Krebs cycle. So it's very good to be absorbed, and of course it's similar. We have the glycinate malate with L-threonate, magnesium L-threonate for the brain mag, which is very protective of brain and peripheral and central nervous system. Well, thank you, Clay, for coming on the program. We'll see you then next Monday, and we'll continue with open lines, and we'll talk about wellness topics. If you have a question, anything to deal with health, and do call in 800-259-5791. And I'm here to call in number for, as I say, there's no such thing as a stupid question. It's important for you to frame the questions in as simple terms as you can for any health issue, because if we start to dissect apart and I can explain in simple terms what's going on, then you can actually become, in a sense, become informed enough to know exactly why we integrate the best of medicine, surgery, advanced technology such as the QRMA, bioplasma NLS, functional medicine, blood, urine, stool, and genetic testing, as well as things like Metatron, which we'll be discussing in the last hour today, hour 4. It's important for you to understand exactly what heart disease is. Remember now, heart disease is an industry in the healthcare industry, and what I'm doing is cross currents. It's the opposite. I'm trying to provide you with the understanding of what is heart and vascular disease. For example, hypertension is your heart compensating for decreased perfusion, and the perceived decreased perfusion, the heart tries to pump harder against resistance because there's not enough peristaltic movement of blood around your circulatory system, because your blood vessels are the primary thing that pumps blood, not your heart. Your heart is a primary way. The secondary way for that peristaltic contraction is your blood vessels with the release of nitric oxide and the contraction of the smooth muscle in your arterial walls, as well as the effect of nitric oxide in the capillary bed. And that's important to understand that. When we look at Supernox, it's going to raise your level of nitric oxide. We use Omega Supreme Krill to heal the blood vessel walls along with ellagic acid and malignoblock. It turns out ellagic acid and malignoblock are very good at repairing the DNA and the oxidative stress and damage. The krill oil, astaxanthin, is one of the most powerful antioxidants, along with NutriDefense, to heal the blood vessel walls because they've been damaged by oxidative stress. The primary thing that counteracts the calcium, which is the primary stressor that causes contraction, is magnesium glycinate malate and magnesium taurate. Now, to stop kidney stones and gallstones, we use magnesium potassium citrate. Omega Supreme Krill and Omega Supreme, I usually recommend both because the krill oil is astaxanthin is going to protect blood vessel walls from plaque. And we use, of course, Omega Supreme is going to change the rheologic thickness of your blood, prevent clots and microclots as well. VascuCare is very important to restore the metabolism of your heart muscle as well as the smooth muscles of your blood vessel walls. It's what's called the special form of propionyl L-carnitine. It's the most advanced carnitine available. We have a slow-release form to normalize bowel activity if you have a abnormal gut spasms or esophageal reflux or allergic problems with the bowel or irritable bowel. That's called IBS-care. The CoQ10 Supreme is the only CoQ10 in the world that doesn't crystallize. We have a special technology to prevent crystallization so it maintains its potency. And I recommend your reserve form too, CoQ10 ubiquinol, CoQ10 Supreme ubiquinol, because it's a very much more highly absorbed form, and it's also reserve form. So when the body needs CoQ10, it'll actually bioconvert it back to CoQ10. You want to protect your blood vessel walls with cell detox glutathione that gets rid of hydroxyl ion free radical. Carnosine, which is going to stop the singlet oxygen, and NutriDefense. So for people with heart disease, there's no excuse. We can reverse congestive heart failure, hypertension, vascular problems where people are getting, silent vasospasm. If you do a Holter monitor, and we did research back in the late 80s when I was in practice in Georgia, and we actually discovered that a third of males just over 30 years of age, a third of males over 30 actually had coronary spasms with significant SGT wave changes at night for numerous episodes at night. And they were silent. They didn't even know they were having coronary vascular spasm while they slept. And more so if they actually kept a diary during the day. And you could see during stressful periods on a phone or talking with a client or doing something emotionally stressful, let's say in a job, that their coronaries literally spasmed right down. And a lot of them were totally unaware they were having coronary spasm, but they could keep their diary as to when they did different activities. We have people requesting hormone balance. I tell people, if you wanted me to do a consult on that, what you need to do first is get the test done at directlabs.com. If you're measuring male and female hormone levels for women who are still not postmenopausal, we recommend the 24-hour full 28-day month panel, and they measure both male and female hormone levels as well as adrenal hormones. And if you're having sleeping disturbance, we do a 24-hour test. We're issuing melatonin, DHEA, and cortisol, and it gives us the normal diurnal pattern. When we measure hormones, we want to measure both male and female because we want to see if you're bioconverting. And then if you purchase a consultation, send me the form. It's under the More Info tab under the consultation. So if you're looking for the form, it's a PDF form. You just hit More Info under either their email or phone consultation, and you'll find the form there. So it gives you an idea how we approach that. And very effective to rebalance your hormones and make sure that they're actually in the proper range. So that can be done anywhere, basically, in the world. Let's see. Now we had a lot of people with chronic fatigue syndromes, and of course, chronic fatigue is due to cytokines, as I mentioned earlier. I like Allergon because I call it cytokinase. I recommend Cognition Plus, Brain Power, and Synaptin to get your brain revved up. I recommend for brain metabolism, CoQ10 Supreme and VascuCare, Neurival to raise the levels of tyrosine and dopamine norepinephrine. Neurival is bioperin plus acetyl L-tyrosine. We recommend for chronic fatigue as well, Allicin Med, Nutriodine, and Silver 100. And, of course, to rebalance the thyroid function, mitothyroid, Nutriodine, and selenium cruciferate. The mitothyroid supplies a thyroid, adrenal, and hypothalamus in a glandular. It's very powerful, and the mitothyroid is very, very well matched with Nutriodine. Usually at least 10 drops twice a day for someone who has chronic fatigue or autoimmunity. But if we do think we're dealing with infection, we'll bump it up to between 15 and 20 drops 3 times a day at minimum. And Allicin Med, at least a capsule 3 times a day. When we're trying to stop the free radicals, of course, we use cell detox, glutathione, Nutricella, and Regenerex. And, of course, we use cell detox glutathione along with carnosine. The glutathione will get rid of hydroxyl free radical and the carnosine singlet oxygen. And to get the body alkaline, which literally stops or blunts cytokine release in chronic fatigue and autoimmunity, we use high-dose Power C. Usually at least 30 grams a day, which are, each capsule is 1.5 grams, so it's pretty easy to take, roughly 9 to 10 capsules 3 times a day if you have a real serious problem, and 1 full vitamin K2 for every 3 Power C. And that gives you an idea of the dosage range there. We can usually adjust that based on things like testing like QRMA or functional medical tests. We can go back and recheck immunologically to see if we've gotten rid of the pathogens and if there's any long-term markers, in IgG or IgM antibodies present in the body. When people have very serious problems like bone necrosis or osteoporosis, I talked about a few days ago with a gentleman whose wife just went through for some surgical plating of her hip, and it turned out when they put the screws in, they thought the bone was weaker than usual. 42% of the dry weight of your bones is collagen, and type 29 collagen, and your bone is crystallized on it. So when they do a DEXA bone scan, they're looking only at bone density, not whether it's bone strength. The QRMA will actually measure both, the quantitative resonant magnetic analysis. And I like the test that can also measure your collagen in your bone. It's called the deoxypyridinium and pyridinoline. It's called a bone density urine test done at directlabs.com through Genova Metametrics. And it complements the DEXA bone scan, which your doctor can order, which is a dual photon scan of your bones. And they can tell you where the weakness areas are, whether it's the surgical neck of your left or right hip or your lumbar spine and a, say, L4 or L5 vertebral body. Those are the weak areas that are more likely to collapse if there's extra stress or a fall. And there's no need for you to suffer like that. So we can reverse that. So again, there's no health condition that we can't reverse with the proper diagnostic tests, equipment, imaging studies, genetics, bone density, and of course quantitative testing like QRMA, 8-DLRS, or Metatron. As I mentioned, we'll be talking about that in hour number 4 today. We'll be back in a moment with your questions, 800-259-5791. Don't be shy to call in on any health topic. And welcome back. And we have, of course, open lines, 800-259-5791. And I think our board op is advising... I guess we were having some trouble with the phone lines this morning. If you have trouble with the phone lines, I want you to call our order line here and call us, and it will be relayed through to us, and then we'll call you. That's 888-212-8871. So that's 888-212-8871 is our order line here at Nutrimedical. And the order line here to call in for questions is 800-259-5791. 800-259-5791. Let's continue with some of the different topics about NutriMeds. And I think, people should understand exactly when we're trying to train you on the functional medicine side. That's why I've renamed the allergon to, I call it cytokinase. It gives you an idea of it affects your cytokine levels in your body, and which is an important factor. And, of course, we're not talking about anti-inflammatory like the typical drugs the doctors will give, like ibuprofen, or even steroids. They interfere with cytokines, but they do it in a broader way that damages some of the protective cytokines and protective molecules in your body. They interfere with collagen metabolism, glycosaminoglycan, which regulates the cartilage production, and they can thin your skin. They can induce problems with blood sugar control and diabetes and central body weight gain. So all very bad. Well, let's start with some of the, I'd like to start with A to Z now this time. For adrenal gland support, and it's very common to find people with chronic fatigue, they'll have what's called a flat curve of their diurnal variation from morning to night of their adrenal steroids, cortisol, DHEA, and melatonin. If that's present, we start off with adrenal support, which contains adrenal glandular and specific vitamins for adrenal support. Very often we'll also find thyroid, so often we see people needing adrenal support gland and mitothyroid, 1 to 2 capsules of mitothyroid in the morning and 1 or 2 in the afternoon. The one of my favorite nutraceuticals is ALC-1000, which is acetylcarnitine, and D-ribose. We have a new one we're adding called NADH. These are all energetic nutraceutical molecules. I like to add the D-ribose and ALC-1000 to my Sports Energy Light drink, which I've polished off my first 22 ounces already, which is really good for this time of the day. And I mix in that 1 large teaspoon each of Brain Mag and Calm Mind, which is very good for stabilizing against stress, maintaining electrolytes, stimulating mitochondrial energy. And I put in there a teaspoon each of ALC 1000 and D-ribose. So that's a very effective energizer electrolyte drink. And in fact, it's so powerful they're nitrogen sachets. So I talk about the Sports Energy Light is one of my favorites. Aller Block, naturally blocking histamine and inflammatory cytokines. And of course, I call it cytokinase or Allergon. We have a special on Allergon now. It's a very expensive enzyme. We bring it in from Europe. But you have I think it's a 30% sale now because we're going to be changing the name, so we're clearing the old product under Aller Block, and when it comes back, it'll be cytokinase. The Allicin Med is one of my other favorites. We were able to get a German standardized high-potency allicin. We still continue to sell the Alimax and Alimed, but you get an additional 200 milligrams of a different stabilizer technology from Germany that gives you 200 milligrams more, a significant price savings. So I like the Allicin Med, and I do take that daily as well. Anti-Age Max, this is one of the most important things. Anti-Age Max, Nutritrala, and Supernox will stimulate all the major pathways to make new mitochondria in your body. Anti-Age Max stimulates what's called the SIRT1 gene, prevents cholesterol oxidation, and has anti-aging effects in mitochondria. Very important. Berberstatin, this clears your gut of yeast and bacteria and fungi. I had our lady earlier today with a SBO or small bowel overgrowth. She'll probably have a positive hydrogen breath test. This will clear it, along with Allicin Med, Nutriodine, and Silver 100. And immunoglobulins to heal the gut wall, Nutri-Immune, 4 capsules twice a day, and Gastro Heal, which is Incarnosine. We also, by the way, have Gastro Cleanse, but it's on special order because you only want to take one bottle. You don't want to be taking it continuously. It's basically a form of Saccharomyces boulardii, and we have the most powerful strain in the world. But we have to special order that for you. If you want some, you have to call us and say, I need the Gastro Cleanse. And you only get one bottle at a time. We don't sell 2 to an individual because it's so powerful. BioLVR. This is going to help methylation pathways for mood, for enzymes, for heavy metal removal, for neurotransmitters, for depression, anxiety. Very, very important. BioLVR for methylation support. Bladder Up. This helps to regulate your bladder hyperactivity. I had a consult this morning with a gentleman whose mom is in their 90s. Getting lots of exercise, but she has some problems with her bladder. So we recommend Bladder Up, a soft gel morning and night. And Swedish flower pollen to maintain an increased tone of her detrusor muscles of her bladder. Swedish flower pollen, which is an alpha-1 natural blocker, 1 to 2 tablets every 4 hours. And that's very tiny little tablets, easy to swallow, little teeny tablets. Bone generator. This is the only way to get your bones up. Don't take any other form of calcium magnesium. This is the actual hydroxyapatite crystals from Argentina. They're certified BSE free, which means it doesn't carry that prion disease. And bone generator, you take 3 to 6 capsules, half hour to 45 minutes after your 2 largest meals. Take with MyCell D3 and Myco D2 and full vitamin K2. And take also Collagen Max, because 42% of the dry weight of your bones is collagen. And Mountain Red Velvet. If you want to rebuild bone, you need to have crystallized on the type 29 collagen. We have, of course, Brain Mag, which is the amazing stuff. Berry flavored, fantastic flavored. During the day, I like the Brain Mag and the Calm Mind and Sports Energy Light with D-ribose and acetyl-L-carnitine, and soon we'll have NADH there also, which is the other high-energy molecule that your body needs. The D-ribose turns NALC 1000 directly into ATP. The NADH makes actually activated nicotine and adenine dinucleotide hydride, which is the other high-energy molecule. And when you combine that, it's just amazing. And we have the Brain Mag, of course, which contains magnesium L-threonate and magnesium glycinate malate to protect your brain. So it's very good for protecting the peripheral and central nervous system, stopping chronic pain syndrome, ruptured discs, peripheral neuropathy, neurodermatitis, where there's a neurological cause of pain, chronic pain like diabetic neuropathy, protecting the brain against oxidative stress. We have Brain Power, which is vinpocetine to protect the brain from aging. It's very good for things like Down syndrome, which is an SOD1 gene dosage problem. People that are getting older, people who have been under oxidative stress or had a traumatic brain injury. We have some vinpocetine already in our cognition plus, and also in our brain, in our synaptin. But this is a super high concentration in the brain power. Calm Mind cherry flavored, and it is so amazing. We sell it by the flat sometimes. It's so popular. This will relax your brain. It'll also cut down addictions to alcohol and other addictive substances, because it'll calm and stops eating disorders, etc., and those other issues. So very, very powerful. We have, of course, Can-C eye drops. This is extremely good to stop the singlet oxygen for protecting your eye against ultraviolet light, reducing glaucoma and intraocular inflammation. And, of course, we have Carbo Block. And if you're trying to, we have a drug that's available to the doctors and diabetologists called Acarbose. Ours is twice as strong as theirs, and it lasts longer. The Carbo Block is extremely important. So I had a consult over the weekend by a lady who had unfortunately deviated and gone to take one of these diet formulas that's like 30 years old, Medifast. And I was saying, please don't do that. You're going to get electrolyte problems. She felt terrible after a week after a, quote, extreme diet. If you want to diet, go on the George Cruz low-carbo diet. Substitute and change into meals and take Carbo Block and lactose blocker to block the sugars in milk and the carbohydrates. And take glycemics to do meal replacement, along with diabetoline, because everybody who's overweight is basically pre-diabetic. Everybody's overweight. So if you're trying to lose weight, diabetoline, chromium cruciferate, and start the glycemics meal replacements, and you're going to be a happy person. You'll lose weight, and it's far superior to the use of Medifast. We'll be back in a moment with hour number 2. Hopefully our phone lines will be working. If you have any questions, 800-259-5791. And if you can't get through, call our orders line here at Nutrimedical at 888-212-8871, and we'll get back to you.